Hello, good afternoon. Welcome, everyone. This is so wonderful to see you all in person. We are so delighted to host this event. I'd like to welcome you here today. My name is Sherry Ryan. I'm the Dean of the Marxe School of Public and International Affairs. I'd like to welcome you on behalf of the Marxe School, Baruch College, the City University of New York, as well as our co-hosts, the NYU Wagner Graduate School Public Service. Thank you for being here as well, and the Columbia School of Social Work. We are not live streaming this event today as we previously thought, but I wish I could welcome the hundreds that wanted to attend that could not be here in person. This is a fitting setting for a program on improving poverty measurement. Many students come to study at the Marxe School or to our host institutions to equip themselves to serve and uplift the neediest in our communities in New York City, in the nation, and beyond. Students want to improve their ability to analyze the causes and consequences of deprivation and to evaluate the efficacy of public policies, social services, and nonprofit organizations. But without good measures of the outcomes that we hope to improve, how can we assess the performance of social policies or the agencies and organizations that adopt them? New York City is also a fitting setting for this event since New York has a long tradition of assisting the needy, including a state constitution that enshrines the right to health care, and New York City's status as the only major US city to guarantee a right to shelter. It's very unique. The state's constitution reads in Article 17, Section 1, the aid, care, and support of the needy are public concerns and shall be provided by the state and by such of its subdivisions. In Section 2, the protection and promotion of the health of its inhabitants of the state are matter of public concern, and provision therefore shall be made by the state. The City of New York has also played an important role in the recent history of reforming poverty measures. A 1995 National Academy panel on poverty measurement recommended that the flawed U.S. official poverty measure be substantially revised. This eventually led to the supplementation of the official measure with a supplemental poverty measure, which was published by the Census Bureau in 2011. But before that time, the New York City Center for Economic Development, Economic Opportunity developed a version of that improved measure for the city and published these results in 2009. This came about through the efforts of the late Mark Leviton and Christine D'Onofrio, who joins the panel here today. Today's event is truly a collaboration between many people and organizations. I'd like to thank President Wu, if he's in the room, Provost Essig of Baruch College for their support. I'd like to thank the co-host institutions. We'd also like to thank Chris Mackey, Connie Citro, and Anthony Mann, and others at the NAS Committee on National Statistics for helping to make this report and the event possible. I'd like to thank our conference staff as well in the room and the staff at the Marxe School for planning this event, and we really appreciate your efforts. So today we'll hear presentations from some of the report authors, 3 of whom are from the co-host institutions. A panel discussion of the report and its recommendations will then follow, and that will be moderated by Dean Sherry Gleed. And we've already noted there's 2 Dean Sherrys in New York City, which is funny. And I understand, Sherry, you have laryngitis, so we'll improvise on that. So I'll briefly introduce the report authors, and Dean Gleed will introduce the panelists. But there is detailed biographic information about all of the presenters here today. So the 5 report authors, they will summarize and explain the recommendations of the report and particularly areas that are challenging for poverty measurement. Professor James Ziliak of the University of Kentucky, the chair of the committee, will provide an introduction and overview. Professor Sanders Korenman will cover medical care. Professor Jane Waldfogel, who's online, zooming in from London, will cover childcare. And Ingrid Ellen of NYU's Wagner School will cover housing. Finally, David Johnson of the National Academy will discuss some statistical and data issues. So with that, I welcome you again, and I welcome Professor Ziliak to the podium.
Thank you, Dean, for that kind introduction. Good afternoon. It's a pleasure to be with you today. Who is advancing the slides? So next slide, please. Okay, great. So, and the next slide, please. Thank you. So this report was an amazing team effort of 14 individuals plus 3 study staff at the National Academy. This was a panel that was assembled during COVID and was conducted completely remotely for a little over 2 years. What was incredible about this panel was the level of commitment across the board to contribute in a meaningful way to the development, understanding, and potential innovations to our measure of poverty in America. As chair, it was an absolute delight to work with my panelists, who include those with us today, along with Randy Aki at UCLA, Sarah Bone at Public Policy Institute of California, Indi Gupta at Center of Law and Social Policy, Bradley Hardy at Georgetown, Helen Levy at Michigan, Jordan Masudera at Columbia, Jose Pacas at Kids First Chicago, Shelley Verploeg at the Economic Research Service, and Bobby Wolf at University of Wisconsin-Madison. And for sure, we need to thank Chris Mackey and Connie Citro and Anthony Mann at the Academy for all their work towards the execution of this report. This report goes through extensive peer review. We had something like 60 pages of referee comments that we had to address as part of this report. And there are 2 monitors, 2 report monitors. Becky Blank was the senior report monitor, and Robert Moffett was the other report monitor. Sadly, Becky Blank passed away this past February. She had to step off from the panel's deliberation towards the very end. However, in true form, she contributed to the very end. Becky was a friend and, to many of us, certainly a champion of scholarship and a champion for improving the well-being of the disenfranchised and disadvantaged in this country. So we dedicate the report to Becky. We also want to thank Robert for his assistance throughout the adjudication of the review part. Next slide, please. So the way these panels work, for those of you who aren't familiar, is that an organization, oftentimes a federal agency, will approach the Academy and ask to assemble a panel because they have a particular issue that they want to address. So our sponsors were the U.S. Census Bureau and the Bureau of Labor Statistics, and Liana Fox from the Census Bureau, who is our sponsor, is with us today. Thank you for being here, Liana. And our statement of task was to evaluate whether or not the supplemental poverty measure is doing its job as originally intended in terms of appropriately measuring the well-being of low-income Americans and informing policy accordingly. As part of that, we were asked to look at whether or not the thresholds are currently being measured properly, and whether or not the resources that we use to determine whether or not somebody is above or below the poverty line are adequately being captured to address well-being overall. So that was our task. In addition, we were tasked to evaluate the data infrastructure that's necessary. Okay, there is a tremendous amount of statistical expertise involved in assembling not only the official poverty measure, but for sure the supplemental poverty measure. And the question is whether or not the current data infrastructure is up to the task. Next slide, please. So our contents, we have a a brief overview, summary. So if you just want the Cliff Notes version, read chapter 0, which is a summary. Then there's the introduction, and then we have a more extensive chapter 2, which is really a synopsis of the whole report. And then chapters 3, 4, and 5 capture the challenging portions of the measure, which I'll allude to in a moment. And then lastly, we conclude with chapter 6 on data and statistical issues. Next slide, please. Okay, so let me back up for a minute here and remind the audience of the evolution of poverty measurement. So we've been measuring poverty in America systematically for over 5 decades. It's known as the official poverty measure, and there are 3 main components. You have the threshold, or otherwise known as the line, and you have resources, which is how much income you have available to meet those needs. That defines the threshold. And then lastly, you have your unit of analysis. So the benchmark official poverty measure was based on a household survey conducted in 1955 and from Molly Orshansky, and the line was determined to be 3 times the nutritively adequate food budget for a family of a given size. It varies by household family size, but does not vary across the nation. Income is a pre-tax measure. Okay, it contains earnings and pension income, Social Security income, disability income. So cash welfare is included, but not in-kind transfers like food stamps, medical care, things like that. And then the unit of analysis is the family, which the Census Bureau defines as 2 or more individuals related by birth, marriage, or adoption, as well as unrelated individuals would be included as a separate unit. And so that's how we've been measuring poverty consistently for over 5 decades. And as was mentioned earlier by the dean, the supplemental poverty measure was introduced officially in 2011. And so there are substantial changes between the OPM and the SPM. The SPM redefined the measure for resources as food, clothing, shelter, utilities, and at the time, what was known as a little bit extra, which was 20% over and above the food, clothing, shelter, utilities. A couple years ago, they split out phone and internet from the utilities portion. So that's how the threshold is measured. There's lots of geographic variation, so it's adjusted for cost of housing across about 400 units across geographic units across the nation. And of course, it still varies by household size, family size. Income includes in-kind benefits like SNAP, WIC, things like that. It includes tax credits, refundable credits like the earned income tax credit and the child tax credit. But it recognizes that what we call disposable income involves subtractions, right, from those additions. And those subtractions are not only tax payments, payroll taxes, state income taxes, federal income taxes, but also include medical out-of-pocket expenses, child support paid, out-of-pocket child care paid, and other work-related expenses. And so it's a much more comprehensive measure of resources for the individual. And then lastly, the Census Bureau adopted a more comprehensive definition of the family, but stopped just a little short of the entire household. Okay? So that's where we stood when our panel was assembled in late 2020. Next slide, please. So our big picture recommendation is recognizing the importance of poverty measurement to inform policy and to inform the public on the well-being of low-income Americans. We have recommended that the supplemental poverty measure be elevated and no longer be considered supplemental, but instead be the nation's headline poverty statistic that would be reported on an annual basis. And we made a recommendation that this be noted as the principal poverty measure, or the PPM. As part of that recommendation in the report, we make recommendations on adjustments to the measure of threshold, the measure of resources, how we define the household. And today, Sandy and Ingrid and Jane are going to tell us some important details on how we propose the Census Bureau execute those changes. Next slide, please. So the evolution then is to go from OPM to SPM and now the PPM. And what the PPM is going to do is we recommend adding health insurance as a basic need for the household, which it currently is not. We recommend including child care as a basic need for households with children, which it's currently not. And we make recommendations on how housing is treated, okay, in that threshold. And so as I mentioned, Sandy's going to talk about health insurance, Jane is going to tell us about health care, and Ingrid's going to tell us about housing today. In order to balance changes in the threshold, we need to balance changes on the resource side. And so that means we propose a modification on how this SPM treats health insurance, how it treats child care, how it treats housing, okay? And then lastly, we make the recommendation that all individuals within a housing unit be counted as part of the poverty unit, okay? In other words, we count everybody in the household. That is our report in a nutshell. And at this point in time, I would be delighted to welcome Sandy to the podium.
Thank you, Jim. Before I start, I want to acknowledge Bobby Wolf of the University of Wisconsin and Helen Levy of the University of Michigan, who are my co-authors for this chapter. And a huge thank you to the incredible professional staff of the Conference Center and the Marxe School for organizing the event, especially Diana Lassoff. By unanimous vote of the panel, the consensus report recommends that the supplemental poverty measure be revised along the lines of the Health Inclusive Poverty Measure, or HIPM, developed by myself and Professor Dahlia Remler, who's here, over the past 12 years. And I also want to acknowledge our collaborator on many HIPM papers over the last 10 years, Dr. Rosemary Hyson, who's with us today. This is actually the second panel, National Academy related panel, to recommend that the supplemental poverty measure be revised to be health inclusive, though the current panel's recommendation is more explicit than the first one. So this report's, if you can go to the next slide, please. This report's recommendation 3.1 says medical care should be incorporated in the principal poverty measure by adding a need for basic health insurance plan to the poverty threshold, and it should add a value to resources to represent the health insurance benefits or subsidies that a household receives to help them meet that need in the threshold. This recommendation, I think, is the most important of the recommendations in the health, in the medical care chapter. So the idea is that for a more accurate measure of poverty, we should include all basic needs and resources available to a household. As Jim noted, our official poverty measure almost completely ignores medical care needs and completely ignores insurance benefits, even though medical care makes up over 18% of the economy, and federal and state governments spend hundreds of billions of dollars annually on Medicare, Medicaid, and other health insurance subsidies. By far the largest transfers of in-kind benefits. The supplemental poverty measure does not entirely ignore health. It subtracts from resources all out-of-pocket spending on health insurance and medical care, which is called MOOP, that out-of-pocket spending, medical out-of-pocket spending. But the supplemental poverty measure threshold lacks an explicit need for health insurance or care. So to understand the importance of this recommendation 3.1, we need to understand why this subtraction from resources is problematic. Conceptually speaking, why does the supplemental poverty measure subtract MOOP spending from resources? I think there are two interpretations, and both are problematic for poverty measurement. The first is that medical care is not considered a basic need and is therefore excluded from the poverty threshold because it's not considered a basic need. In this view, the real basic needs are food, clothing, shelter, internet, so forth. And so spending on health care and health insurance, in that case, only reduces the household's ability to meet the real needs. So we should subtract MOOP spending from resources. Of course, the problem with this interpretation is that most people do think health care is an essential need, and this interpretation, therefore, does not accord very well with commonly held conceptions of needs and poverty. So the second interpretation is that the supplemental poverty measure indeed considers health care a basic need and uses the subtraction of MOOP spending from resources as a way to measure those needs. And therefore, the subtraction from resources represents kind of an implicit need for medical care or insurance. And there are at least three problems with that interpretation. First, in this view, the basic health need becomes defined as whatever you spend out of pocket on insurance or care. But that means that low-income, uninsured people who forego or delay needed care have no unmeasured health needs. That is, their basic need for health care is fully met. This makes little sense and results in understated unmet needs and understated poverty for that reason. Okay, for that reason, it understates. The second problem with having no explicit need for health care or insurance in the threshold is that we cannot validly add to resources the huge sums governments spend on to provide health insurance as a benefit to households to help them meet this health care or health insurance need. If we did add those benefits to resources with no health need in the threshold, we would be asserting that households with little income could use their health insurance to meet their other needs, such as housing. That also makes little sense. Furthermore, if we are unable to validly include health insurance benefits in resources, then the supplemental poverty measure cannot be used to estimate the direct impact of these hundreds of billions of dollars of health insurance benefits and so forth. So that reduces the supplemental poverty measure's accuracy and utility as a social or economic statistic. A third problem is that the supplemental poverty measure subtraction for MOOP spending is uncapped and can include spending on non-basic care or non-basic insurance. So the recommendation 3.1 aims to fix these limitations by incorporating health insurance needs and benefits explicitly into the poverty measure. Recommendations 3.2 and 3.3 are essentially pragmatic recommendations about the specific definition of the basic health insurance need for the threshold. 3.2 says that we should use the unsubsidized premium of the benchmark silver plan from the Affordable Care Act marketplaces as the basic health insurance need for everyone except Medicare beneficiaries. And for Medicare beneficiaries, we should, according to recommendation 3.3, identify the basic plan as the full cost, including government contributions, for a Medicaid Advantage plan that provides a prescription drug coverage. And the specific recommendation is for the least expensive of these plans in the area of residence. I will say that the first recommendation, 3.2, is actually enabled by regulations of the Affordable Care Act, since it made it easy to identify the cost of a plan for any individual. There's community rating, so what you need to spend to obtain a basic health insurance plan is essentially determined by your age and your residential location. It does not depend on specific health status characteristics. Next slide, please. So now on the resource side of the poverty equation, recommendation 3.4 says that household resources should include a value for any health insurance benefits or subsidies received from an employer or from the government, but must also reflect the fact that such transfers cannot be used to pay for non-health needs. This is achieved by capping the value of the transfer that is added to resources at the value that is in the threshold, not more than what's in the threshold. This is an important feature of the measure because it makes sure that the value in the resources never exceeds the need, therefore preventing the assertion that health insurance can be directly used to meet other needs, such as housing. And finally, the last recommendation is for out-of-pocket spending on cost sharing. That's deductibles and co-payments and the like. And here, the PPM is closer to the SPM. It's a modification of the same kind of subtraction that the SPM makes. We subtract out-of-pocket spending on care or cost sharing, but cap that at the limits available either with the basic plan or perhaps lower depending on the health insurance that the family actually has. So in sum, the PPM adds a need for health insurance to the SPM threshold, but does not have an explicit need for cost sharing. I would say more research is needed on dealing with cost sharing, and anybody who has a decade or so to spare, I encourage you to work on that. One other recommendation for research in the report is that this doesn't handle well extraordinary expenses that disabled persons with disabilities might have, and that is also, I think, a productive area for future research. Thank you. To Ingrid. No, to your right, Jane.
Great. Are people able to see the slides? We should be on the next slide, which says child care. And can you hear me okay?
Yes.
Yes? Yes, you can hear me?
Yes.
Yes? Was that a yes?
Yes, we can hear you, Jane. Yes, can you hear? Okay.
Thank you. I'm sorry I'm not able to be there in person. I'm on sabbatical this year in London, so I'm grateful to you all for accommodating me by Zoom, although it is late in the day for me here. I'm going to talk about the child care recommendations that we made that are in Chapter 4, and as I go through these, you'll I'm sure understand that the situation of child care is in many ways very similar to the situation of medical care, which Sandy just explained so clearly, with one really striking difference, well, two really striking differences. One is that Sandy and Dahlia and Rosemary have not spent the past decade looking at child care and how to improve its measurement, as they did with medical care. And two, child care is not as universally used as is the case for health care and medical care. And so you'll notice that the recommendations for the child care chapter look quite different. I think of them as being incremental, and the simple reason for that is that we simply have not had the research in the child care arena that we had in the medical care arena, thanks to the work that Sandy and Dahlia and Rosemary did. And so the child care chapter makes more modest recommendations, which I hope will get us to the same place eventually, but in a more incremental fashion. So recommendation 4.1 is really a technical fix to the current SPM. Currently in the SPM, parents who are working can have child care costs deducted from their resources, just as one would deduct medical out-of-pocket expenditures. The SPM deducts child care expenditures if a parent is working and if there's no other parent available to care for the children. We recommend that that be extended to also cover parents who are in education or training. They should be treated like parents who are employed. And alongside that, a parent who is not working and is disabled shouldn't be assumed to be available to provide child care while the other parent is working or in education and training. So that's really a technical fix. Recommendation 4.2 starts moving into the more in the direction of improving the measurement of child care in line with the thrust of the overall report. So starting with households who use paid child care, and not all households do, but households who either pay out of pocket or use paid care in the form of subsidized care, we're recommending that a basic child care need should be included in the threshold And in the near future, the Census Bureau should conduct research to develop and implement a methodology for doing that, for defining the amount of the basic child care need. And of course, that would have to vary by the age and number of children, geographic location, and the hours of paid care that are used. If we're going to include child care in the threshold, we would need to do this, and the starting point would be families who are using paid child care. Let's go to the next slide. What's challenging in the child care arena, of course, is that many households have children and don't use child care. So, but let me start first with recommendation 4.3, sticking with households that have children and do use paid child care. If we're going to add the cost of child care into the threshold, we also need a methodology to implement that the Census Bureau should research, develop, and implement for valuing assistance received by households for child care, so that that can be entered into the calculation of available resources. As Sandy was talking about the resources that the government spends every year on medical care or health care, of course I was thinking about the resources that the government spends every year on child care. And right now those resources are not really accounted for in the SPM. And so if the government spends more money on child care or it cuts back on child care expenditures, that's not captured in the SPM. And that's a real failing, that's a real limitation. So recommendation 4.3 would help address that for the families using paid child care, including subsidized care. Finally, recommendation 4.4 turns to the fact that many households with children do not use paid child care, don't use paid child care at all, or you don't use paid child care for some of their child care time. They might use a mix of paid care and family provided care. And so many families, at least part of the time, if not all of the time, are providing care for their children themselves, whether through parental care or care by other relatives or friends. This is really different from the healthcare arena. There are not many people who never use formal health care. At some point, everyone has some condition or injury where they have to receive some health care. This is not the case with child care. All children need care, but not every family uses formal child care. Many families use care that they provide themselves or through family, friends, or relatives. So this really needs future discussion and research to understand the topic of unpaid child care, whether such care should be reflected in poverty measurement, and if so, how. And so we call on the Census Bureau and researchers to conduct future research and discussion to help figure out how to do this in an appropriate way. And with that, I'll hand off to Ingrid.
Thank you, Jane. And I also just want to say thank you to our hosts at Baruch for organizing this event, and thank you to all my fellow panelists and to Jim in particular for chairing this panel. I learned a tremendous amount, and I think that we've got the report. I think it's a nice contribution, and hopefully we'll move our measurement of poverty forward. And so I want to talk about housing, and I want to start by just saying, sort of stating the obvious, which is housing is the largest component of household spending, right? Just to give you one statistic, right, in 2001, renter households in the bottom quintile of income, on average, spent 63% of their income on housing. So they spent like almost 2/3 of their already very low incomes on housing. And so the choice of how to handle the cost of housing in a poverty measure can have a major impact on who is counted as poor, and on how many people are counted as poor. Shelter, to be clear, right? Unlike health care and unlike medical care and health insurance and child care, housing is already included in the threshold measure for the current SPM, but our aim was to treat housing and utility costs in a in a more clear, transparent, and consistent way. And our first, and that takes me to our first key recommendation, recommendation 5.1, relates to housing thresholds, which aim to capture the cost of securing adequate shelter. And we recommend that housing thresholds are set based on shelter costs for renters in the local metropolitan area or the rural county where those households live, since most low-income households rent, and more fundamentally, all households, regardless of whether they own their home or they rent their home, face the same basic need for shelter. And I'll say more about that in a minute. But further, right, we recommend that the principal poverty measure set threshold based on the U.S. Department of Housing and Urban Development's, or HUD's, fair market rents, which are estimated annually to capture the threshold cost for a standard quality private market dwelling. And in the local market. And fair market rents are generally, more specifically set at the 40th percentile of, let me see if I get this right, at the 40th percentile of standard quality homes for recent movers in that metropolitan area. And they vary, fair market rents, and the idea of recent movers is that that's a way to those housing costs for recent movers sort of more accurately capture the cost of housing for someone who is sort of currently seeking housing and looking to live in an area. Fair market rents vary across local markets. They vary with the number of bedrooms in a housing unit, and they are estimated annually, mostly, or primarily, not exclusively, but primarily to set subsidy levels for the Housing Choice Voucher Program, which is the largest rental subsidy program in the United States, and basically pays part of the rent of low-income households who are renting homes on the private market. Okay, and the HUD basically pegs voucher subsidies to the local fair market rent to ensure that the subsidies that they pay to low-income renters are appropriately sized given the size of that family and the housing cost in the local area where that family lives, where that household lives. And so the advantages, we think there's several advantages to using the fair market rent, right? One, it's simple, it's transparent, it's feasible, right? It's already collected and calculated. There are a lot of researchers at HUD and the census that spent a lot of time on this. And plus, it has this very nice feature. It's sort of consistent with our recommendations in the medical care chapter that we're using. It's suggesting sort of using a pre-existing basic, a measure of basic need and cost that's already collected and already used by the government for other purposes. So we think that that's sort of a nice feature. Okay, a second key related recommendation, which is that we think that the PPM we recommend that the PPM use a single threshold for all households, a single housing cost threshold for all households, rather than the adjustment. There's a separate threshold for renters, a separate threshold for homeowners with mortgages, and a separate threshold for homeowners without mortgages. And we think that's sort of complicated, the way that the adjustments are done. It's not very transparent. And plus, conceptually, maybe more importantly, we think that the PPM threshold should really capture what it costs to live in and rent, right, or live in a decent quality home in a given metropolitan area, regardless of how the choice that a particular household makes about how to pay for or how to finance that shelter. And so we think that the PPM should continue to be to adjust for cost of living differences across areas, but we don't think that it should vary. The threshold should not vary based on households' consumption or financing choices. Okay, so that said, if you can move on to the next slide. We do believe that the PPM should account for the fact that homeowners do have an asset or a resource that essentially is delivering income to them, right? And we think that implicit rental income should be treated as a resource. So in other words, right, homeowners are benefit from, oh, sorry. Oh, press the bar. Okay, if it's not, okay. But that's the right slide. Okay. Yeah, that's the right slide. That homeowners are basically receiving a benefit from renting to themselves or not having to pay monthly rent, which frees up resources for other needs, right? And so we believe that the PPM should take into account the rental value of a homeowner's home on the resource size, and admittedly, right, accurately capturing the rental value of an owner-occupied home is a little challenging, right? Because by definition, it's not observed, right? But many government agencies around the world do this, right? And including the U.S. Bureau of Economic Analysis in valuing shelter services for the calculation of GDP. So we think our government officials are well up to the task of doing this. We know they are. And in the short run, we think that the Census Bureau could simply use fair market rent for the local market and for that household size as an estimate of the implicit rental income. And this would be consistent with the use of fair market rents on the threshold side, and it has the advantage of automatically capping the implicit rental income at the fair market rent. And so basically, there might be some homeowners who are living in, some low-income homeowners, probably not a lot, but some that are living in larger and more expensive homes. But it's not easy to convert the value of those larger and more expensive homes into disposable income and consumption of other goods. And so we think that basically we think that you should only credit homeowners, we argue, for up to the amount that it takes to rent a standard quality dwelling, of an appropriate size in their local market. Okay. And finally, this last recommendation, 5.7, I should say that there are other recommendations that all of us are skipping over. We're trying to sort of just give you the highlights, but that homeowners do face ongoing costs, right, in owning their homes. And so we recommended that homeowners' user costs be subtracted from that implicit rental income and on the resource side. So such user costs would include mortgage interest payments, property taxes, and other sort of regular maintenance incurred by homeowners in general, not by that specific homeowner. And so we recommend capping those user costs. I know this is getting a little technical, but at the value of the implicit rental income. So basically, net implicit rental income can't be negative. Okay, so what does that mean? It means Sandy's nodding. Probably the rest of you are like, what is she talking about? But anyway, but basically, let me say it this. So that while homeowners that face really high user costs, right, say they have really high property taxes, right, they can we might credit them with zero implicit income, right? And so they basically be treated like renters, right? But we're never going to assume that homeowners are we suggest that homeowners shouldn't be treated as worse off than renters in that local market who also who actually have to pay out of pocket for their rent. And I should say, I'll sort of end with a note that we do, I'd say, sort of softly recommend that mortgage principal payments be excluded from those user costs, because essentially they are transfers kind of from one savings vehicle to another. And don't really represent a true cost of homeownership. I will say that was not a 100% consensus recommendation, but I would say most of the panelists agreed with that. So I think with that, I am going to turn it over to David, right? Okay, and we can advance the slides, it turns out, with the space bar.
Thank you, and let me say that I'm thrilled. I'm really thrilled to be here. I remember 30 years ago, I went down. I was a new PhD at Bureau of Labor Statistics and went down to the National Academy Office on Constitution. And this small little room, I went in, and there's Bob Michael and Angus Deaton and Becky Blank and Sheldon Danziger all talking about poverty. And that was the first NAS report that came out of that. And I spent many, many months producing reams and reams of tables. So to come full circle and now to be on a panel that's basically recommending the third generation of that report is truly a thrill. And so I thank all of you for coming. I thank the panel. I thank Jim for leading it. It was great. But now we've heard about a lot of the improvements of constructing the PPM. And of all those come with a lot of data needs. So I want to go over some of the challenges that Census and BLS will now have trying to improve their data to produce the most accurate and timely and relevant poverty estimates, looking at both the resources and the thresholds. And as with the original NAS report and the Interagency Working Group report, our report encouraged the agencies to constantly improve their data and their measurement. So 3 key data needs. You've heard a lot about healthcare, housing, and childcare, and all of those require new questions on the surveys. So there's a lot of research they're going to have to do to change some of the questions to account for housing costs or childcare costs or those types of things. The second thing they have to do is look at more surveys. The key is we think it's important to look at the geographic detail on the new PPM. So since it's appropriate they were here, since New York City actually led the way in producing the first ever SPM type measure with the ACS data, and Christine's here representing them, we think, and this is recommendation 6.1, that the Census Bureau needs to work to produce a PPM on the ACS. So to show how these things differ by geography, more data. And then we need blended data. So currently surveys suffer from non-response and underreporting. In fact, I learned last week that 45% of the income in the official measure is imputed. So that's higher than it's ever been. So the surveys are a problem. So this key recommending 6.2 says what they should do is expand the use of administrative data, mainly looking at income and program benefits, to aggressively improve the surveys. So 2 recent efforts that the Census Bureau does that has a national experimental well-being statistics. It's blending all the income data that you can get. And there's an external project, the Comprehensive Income Database. And they both finds that the poverty rate, the official rate, would be about 1.1 percentage points lower if they used all this tax data. And the other thing, looking at transfers, in-kind transfers, if you substituted all the administrative data on in-kind transfers instead of using the survey reports, you'd also decrease poverty by about 1 percentage point. So you put them all together, the PPM and the SP could be as much as 2 to 3 percentage points lower than the numbers you just saw last month. So I think this is important. So 6.2 says expand that, and 6.3 says start doing it. So we think you should use this. Census could use the data. So for instance, this new system, they could use that to produce a historical SPM, or at least a current SPM, with all this blended data, and keep producing that in as fast as they can. Now, at the recent advisory committee for Census, they said that Census should look at this. So this is a good step. They're going to start looking at that. And they should then update this as frequently as can. So secondly, the Chapter 6 looks at the details in the threshold. So you just heard about looking at the SPM and the PPM, where the healthcare and the housing and the child care would be important to be on the threshold side and important to be on the resource side. The thresholds have a lot of things going on. So it's not just the food, clothing, shelter, and utilities, and telephone and internet that you had. Now it's food, clothing, shelter, and utilities, food, clothing, telephone, and internet, plus housing, plus healthcare, plus child care. All 3 of those things differ depending on how many adults and kids you have. So the Census Bureau is going to have to figure out how to do these equivalence scale adjustments. In fact, it's one of my favorite topics. In fact, after that meeting 30 years ago, I gave Angus and Bob a little table that looked at equivalence scales. So this recommendation says there's a lot of research to do Should you use an overall scale? Should you have a scale for food separate from clothing, separate from housing, separate from health, separate from childcare? How do these things interact? How are you going to make the scales just on food, clothing, telephone, and internet? And then, like was said before about disability, should you then adjust the scales for special children needs? So currently there are different scales for kids, but not for kids by different ages. Teenagers likely cost more than 5-year-olds. And if there's a disabled one, it might also cost more. So 2 other things that have to deal with the thresholds that come in an early chapter is there's a recommendation to move to the household unit. Jim mentioned this. So this, if you looked at how many families live together in households, they're doubling up, and they're actually sharing some resources, mainly housing. So we thought the unit should be better as the household. And lastly, there's this multiplier. So we didn't talk about the fact that the current SPM is food, clothing, shelter, utilities, telephone, and internet, then multiplied by a 20% factor that accounts for all this other stuff that's not in food, clothing, shelter, and utilities. So how do we make that adjustment now that we're looking at all these things separately? How should this occur in the future? I think those are also important questions. Okay, I wanted to end with a comment that's a little part of the report. This is maybe off topic, but the whole idea of these thresholds, people have been hearing that they're what are called quasi-relative. In other words, a quasi-relative threshold means it goes up more than inflation, but less than the changes in income. And some people think that the threshold should be absolute, changing only with inflation. Well, with this new measure, it's not clear how it's going to be quasi-relative, since we don't know how the ACA silver plan changes over time. We don't know how fair market rents change over time. We don't know how child care costs change over time. And we actually don't even know how just food and clothing spending changes over time. So it could be that it goes up more or less than inflation. And with other things like different inflation rates for low-income people, it could be that the inflation for low-income people is actually higher than that. So there's a lot of things, and I think my point is there's a lot of moving parts still in this that take a lot of work to look at. And I think the important thing the panel tried to do is bring all those moving parts together to get a better measure of the PPM. And so I thank you for all that. And I turn it back to Jim.
Thank you, David. So we're going to wrap up this portion of the event with highlighting, and it's actually kind of an extension of what David was mentioning just now, and that's, the panel views the poverty measure as not necessarily an absolute measure in the fact that we're never going to change it again. It's kind of an organic measure. It's got to change over time. It needs to be reevaluated as economic conditions change, as society changes. So it's going to need to be reviewed on a regular basis. And, recommendations along on every 5 years or something along those lines to do a comprehensive review of whether or not the PPM is living up to its stated goals to measure the economic well-being of low-income households in the United States. Moreover, as part of that reassessment, ideally, the future panels of experts will try to tackle some of the issues that we didn't come to agreement on. And these include how to treat food. So for example, we're moving more towards an expert-based or a policy-based threshold by moving the Affordable Care Act measure of health insurance in the threshold, potentially using child care subsidy rates as a measure of child care need in the threshold, moving to fair market rents for housing in the threshold. Well, we have a massive food assistance program called SNAP, right? We're spending over $100 billion a year now on SNAP. And there is a kind of a policy-based measure of food need. And the panel decided not to pursue that route at this point in time because the food stamp benefit is based on people's producing food at home only. It's not food away from home. But we know Americans spend a sizable share of their income, food budget, eating out, okay? And so that's an area of future research. We also recognize that for the average American, the second largest budget item is transportation. And coming from a state that's quite rural, and especially the Appalachian part of the state, the eastern part, where transportation is a substantial barrier for many households. So the panel felt as though there was not an adequate resource base to, at this point in time, develop a measure of including transportation as a basic need in the threshold, though there was strong sentiment that such work needs to be done going forward. And then lastly, and this is apropos being here at a university, and that's how do you deal with debt and assets and education? And the panel had a rigorous discussion on this, and we decided to take a pass on formally including any measure of assets and debt accordingly through education. By the way, there is currently in the current measure, both the OPM and the SPM, we do have some education assistance that is included as part of income overall. The question is, what do you do with debt? And the panel felt as though, again, there's a lot of dissension on moving away from a measure of income-based measure as opposed to more of a wealth-based measure. And so when you think about education, it becomes more complicated discussions on how you quantify human capital. So we decided not to tackle that with this report, but that does not mean we don't think it's an important area of future consideration. Okay? With that, I would like to thank you for your attention. And do we have time for a question, or do you want to get started the panel? Yeah, through the panel. Great. Thank you so much, and I'll welcome the next panel up.
Good morning, afternoon, sorry. So everyone's bios are in the document, so I'm not going to take time for those. And we just heard an amazing presentation of a large consensus report, all summed up in 50 minutes. So I think we can just jump right in. I think the first question I want to ask would go to Carolyn and Sheldon, in any order. What do you see as the main implications for policy and advocacy from these recommendations of changes made to the SPM and making it the primary policy measure for understanding poverty and to headline poverty measure?
So, is this on? Let me start by saying this is a terrific report. 11 of the 14 members have had funding from the Russell Sage Foundation, so with my hat on, that well spent. And it says something, I'll get to policy, but I want to say something about what academics do. So the most important thing this report does is make the 1995 report that I was on obsolete. This, you know, if you were teaching, there's no reason to go back to that one. You should go to this one. But it also shows the importance of playing the long game, which too many foundations don't realize. I can remember when Korenman and Remler sent a proposal to Russell Sage in 2015, and they got lots of critical comments. Well, they've been at it for a long time, and recommendation 3.1 is perfectly right now. The link to policy is we couldn't have done this in 1995 because there wasn't the Affordable Care Act. So Sherry Gleed was at HHS when Obamacare was implemented. And so some of this is a link between research and policy. You have academic researchers who persistently, against the tide of people saying we don't need this in the case of health, pushed forward, and the Affordable Care Act gives you the thresholds that they can add to the measure, just like in the early period we had fair market rents, this report does better on housing because we have better data and better thinking. And the child care issue that Jane said is like housing was in 1995. We don't have something that we can use. So I'd say it's a terrific report. I would also say about the measure, the recommendation that this become the official measure. The SPM is already the official measure. The New York Times report on poverty essentially is recommendation 2.1. Poverty rate soared in 2020 as aid ended and prices rose. And then there's a chart and data. And then when you get into the story, which most people don't read that far, it says the official poverty measure, an older measure that is widely considered outdated because it includes many of the government's most important anti-poverty programs, among other shortcomings, was nearly flat last year. So, you know, right now the simple thing to do is to make the SPM the official measure and work on getting the PPM in. What's the link to policy? Why do we even have the SPM? Because Becky Blank was appointed by Obama to a position in the Commerce Department that let her do that. So the one thing I'd say about policy is, I go back to what David Johnson said. If it turns out that the PPM will lead to a lower poverty rate, your likelihood of getting an administration to move it through OB is higher than if doing it would lead to a higher. So I probably said enough to start. Not much about policy. I'll let Carolyn say something about policy and advocacy.
You've said it all. So I come at this from a different perspective. I study how assistance programs are delivered. I focus on the intersections of SNAP, WIC, and Medicaid, and I've done some work on child care. So I talk to state administrators and frontline workers all the time about what it's like to deliver these programs. And then I talk to a whole bunch of folks that are trying to access these benefit programs and either can or can't, and the reasons behind that. So when I read this report and I see this presentation, the question I have is, what would a state administrator do with this information? And right now, nothing, because eligibility is determined by the use of the official poverty measure. And that's when things get a little tricky. If supplemental measure is, or this new proposed measure that builds off the supplemental measures, including in-kind aid, it's difficult to see how that might change some of the things that I care about, that being accessibility to these benefit programs. But because we have great evidence that using the supplemental measure and potentially this new measure, when we include in-kind aid programs, reduces poverty, you could make the case for more generous programs. That's difficult. Politically speaking, that is a challenge. We saw in sort of the budget crisis and debate the addition of new work requirements for SNAP and able-bodied folks without kids. There's always been state variation due to federalism on accessibility of programs. So I think the tie to policy is sort of figuring out ways to advocate for more generous benefits, but also thinking through the consequences of federalism and politics that might undermine that. And that is a whole nother panel that we probably couldn't get into to those issues today, but those are some general thoughts.
I'm sure our people will build on those, but let me turn now about the research implications to Dahlia and Chris. So what kind of research would help us evaluate whether these changes, the impacts of these changes and whether they would be effective? Were there particular recommendations that cried out for follow-up research and analysis as we move forward? And how would these affect research on what contributes to and flows from poverty?
Yeah, so the first thing is I think we really need to assess the validity of the PPM on its own and compared to other potential poverty measures. And I mean validity in the formal measurement sense. How well does a measure's operationalization match its conceptualization, what we want to measure? So poverty, at least in the US, is defined as not having sufficient resources to obtain a minimally adequate standard of living as determined socially and politically. So that obviously begs the question, what does our society think, individually and collectively, is a minimally adequate standard of living? And when there are differences, how is the political system answered? So first of all, terminology, I'm going to use the term needs simply as a shorter version of minimally adequate standard of living. I don't mean anything else by the term. So before we can even answer validity, we need more research on the conceptualization, on what basic needs are according to our society. And there are several elements of the PPM's conceptualization, explicit and implicit, that you've heard about that I think need research. The first goes at a long-standing debate in policy. Do people think of needs as some amount of dollars? And it's arbitrary, since people differ. You can draw the line anywhere. Or do we think of it as some amount of expenditures? Or do we think of it as a bundle of goods and services? And if we think of it as a bundle of goods and services, do we need to operationalize that through expenditures on certain goods, as the current SPM based on the 95 report does, or can we operationalize it as a specific bundle? And the PPM is moving in this direction with its changes in housing, health insurance, and childcare. And a couple of things. I don't really think this is a technical debate. This is about how people in society think about and decide what basic needs are. And I think we need to include, for lack of a better term, the other politically conservative perspective on poverty measure. And a lot of these things will get at some of the relative price issues, things that David was talking about. Second, if we do conceptualize it as a bundle, which goods and services are basic needs? The PPM is expanding the threshold to include health insurance and childcare, and they discussed some of the others. So I put a lot of effort into trying to assess the extent that people see health insurance as a basic need. I found support for that. But we need more empirical research on that, on childcare, and in some of the other issues that Jim brought up. Among those needed goods and services, the next question is how much? Of what quality, which a number of people have touched on. So everyone agrees housing is a basic need. And I think what the PPM does, treating that need as a need to pay rent that varies geographically, I would guess would have widespread support. However, you could still disagree a lot on the level. That particular fair market rent, which I understand is the 40th percentile of the distribution of recent rents in the area. I'm not a housing expert, but people could really disagree about that. And so when you assess the PPM recommendations, we really need to differentiate between the general approach and the specific level. Just like a lot of people said, oh yeah, everyone needs health insurance, and I don't agree with you about that benchmark silver plan. The PPM is also, as you've heard, making a lot of changes to resources. In the health inclusive poverty measure, we said, hey, everyone needs basic health insurance. But some people have that need fully or partly met by government or employer benefits. And again, the PPM has moved in that direction, you heard about with housing in particular, to treat benefits and other resources explicitly. Homeowners have the same need for housing, just met partly or fully by owning their own home. People in public housing have the same housing need, met by public housing. So I'm going to talk in a second about how I think you should assess that through qualitative research on the general public. These issues are too technical for that. You can do analysis to show the implications and assess the feasibility. So now I'm going to put in a plug for Sandy's and my recent just out paper in the Journal of Health Politics, Policy, and Law, which among other things does look at the implications of the full income poverty measure treatment of health benefits as fully fungible. So what kind of research? I think it should be qualitative initially, perhaps primarily. I would recommend focus groups because needs are socially defined, and I would have two kinds. one with people from the same social economic classes and other ones mixing them. There's also this enormous body of legislation, media, social media. When you have those, you can build on that to develop survey questions and get more quantitative data on prevalence. I also think you should do quantitative validation studies, how well are poverty measures correlated with hardship measures, other poverty indicators. And in Sandy's and my empirical work with Rosemary and Heisen, we tried to do that. I think it's important, but I'm skeptical that these could be deciding factors. Some dimensions of hardship have no good indicators in most data set. Poverty squishes lots of things. You can have a major hardship in one dimension, but not another, like people who live in their cars, but have adequate other income. So, how will these measure affect research? The biggest thing, or one of the biggest things, is it can prove international comparisons by broadening and integrating the kinds of benefits assessed.
Go ahead.
Yeah. Okay.
One more minute.
Okay, so in the UK, you can take an income-based poverty measure, add per capita national health insurance expenditures to the threshold, add the same thing to resources. Cancels in the poverty rate, but now you can show how the NHS reduces poverty in the UK. And if you have a health-inclusive poverty measure in the US, it can be a valid comparison. The PPM is going to expand the ability to do that to free universal childcare, more extensive public housing, and so on. You'd need to create a PPM in other countries. Don't have room for my other recommendations, so I will end with on a personal note. I can't tell everyone how exciting it is. You know, Sandy and I started this 12 years ago, and the SPM came out, and to see it play such a role is really moving. And I also want to thank the Russell Sage Foundation for funding us.
Well, that was amazing, Dan. Thank you. Chris, what do you have to add?
Yeah, I actually have a totally different direction that I took that question. So the NAS report in 1995 that David talked about and Sheldon talked about and others was really a springboard and a foundation for about a decade and a half of research that followed, that culminated in the 2011 release of the actual SPM, which at the time was called the Research Supplemental Poverty Measure, not even the Supplemental Poverty Measure. And basically the NAS report in 95 kind of laid the groundwork for all of that research that then turned into that. So I guess where I fundamentally see this report is doing a similar job and laying the foundation for probably a decade and a half of new research before we come to a PPM. And so I think the PPM will probably get released in 2039, and I think that sounds about right to me. And the reason I think that is because in the report, in I think chapter 1 or 2, I think it's chapter 2, there's this great discussion of the principles behind a poverty measure. And there's, I think, 6 that are described. One is the accuracy, another is timeliness, another is completeness, consistency, transparency, and feasibility. And the report rightly notes that a lot of times these principles are in tension in a poverty measure. In particular, the concept of accuracy might be in tension with the principle of consistency, right? If we make an improvement that relies on some new survey question or some newly available piece of data, then we're going to have sort of maybe a break in series that's hard to implement and understand changes in poverty over time. In general, the report comes down in favor of accuracy, which I think I would too. I think what I see as important is that we really come to a sense of completeness in this measure and establish the accuracy in the measure before we go on and make changes to something that's already 75% or 80% decent and an improvement on what's been done in the past. And so there's a lot and there's these three big challenge areas in the report, right? One is health, one is childcare, one is housing. And we're in very different places with each of those, right? We're in a much better place with health given the work of Dahlia and Sandy and Rosemary and others. And I'd say in housing we're somewhere in the middle, and then in childcare we're really kind of in the infancy, if you will. And I would hate for the improvement of the measure to be sort of piecemeal, every 2 years where we go from 75% good to 78% good to 81% good to 84% good over a period and introduce all these breaks. And where I think even in the healthcare where it's far enough along, I think the research, there's still a lot of research to be done, especially on the resources side of the equation. So when someone gets $800 in SNAP, we know that that's more than $600 in SNAP, but that's more than $400 in SNAP. For housing, even though we understand the idea of implicit rent or healthcare where we have the value of a health insurance, we know that health insurance plans vary tremendously in quality. We understand that we want to cap that so it doesn't go over the cost that's embedded in the threshold, but there are variations probably underneath the resources that are counted, and that's going to be true in implicit rent, and that's going to be true in whatever we do in childcare. And so I think really getting that complete, well thought out, and proven is a necessary step, and probably is going to take about 15 years.
Whew, that's great. So we're going to move now to Leanna and Chris, and Christine, sorry. But before I do that, I just want to make a quick point about Chris Weimer's work with Leanna and Leanna's effort to make this happen. So we had the 2011 report on the SPM that started an annual report. But one of the things that Columbia did is they anchored the SPM and really looked at the impacts when you took all the reasons why you should have an SPM as a measure, because it accounts for the role of public policy. And they really looked at that, and they looked at that for subgroups like children whose poverty we care, or I care more about. I care about everyone's poverty, but I care more about. So just that, that's not something we're here to talk about today, but I just want to sort of point that out and point that research out. Because it probably does have implications for when you're ready to anchor the PPM after you've done the 16 years of research that Chris highlights. So with that, let me ask you for measurement implications, Christine and Leanna, and you can go in any order. What are the important questions you would like to see answered before making decisions about implementing the proposed changes? They don't have to be the same as Chris's. And for both New York City's poverty measure and the PPM. And do you consider any of these recommendations more of a priority or more ripe to start to implement?
Okay, so I'll talk about New York City specifically. So we do a poverty measure. It's solely for New York City, and it uses the American Community Survey, which gives us which gives us a different database to work from, and a different. Some of the descriptors that we use are a bit different, but. So my comments are kind of based on a couple of things. One is that we're also, because we're in city government, we're kind of in the front line of policy. So all of the requests that we get are, they never cease to amaze me at how many different ways people look for information in the poverty data. So to that, I really need to enforce what Chris was just saying, that changing the PPM throws a monkey wrench in a lot of agency work that goes on, where certain guidelines are set based on the poverty data, both ours and the SPM and the official measure. So yeah, quality assurance before things begin is really important. And also I'm thinking about the quality of data, maintaining it through the ACS and at the city level. And also, I need to stop and thank the panel for doing this, because having all this information in one place is like a gift. It's such a great, thorough review of everything that's happened in the past 20 years that it's just constantly going to be in use for us, especially as we think about, we'd like to try and stay kind of in sync with the SPM as much as we can. So to that end, my biggest concern about these changes is something that hasn't gotten a lot of attention, which is the change from the consumer unit to the household unit as a unit of analysis. That is, for us, a big problem in some ways, because we build consumer units out of the American Community Survey. They're very extended family units, blood relations, unmarried partners, children of all these people. We also bring in the children under 15, assuming that somebody in that household is taking care of them. And even though their income might be from external support, like child support, that's true of every child in the ACS, because there's no child support data. So we just bring them all in. And then anybody that is absolutely unrelated and even classifies themselves as a room boarder or a renter becomes a separate consumer unit in that domicile, right? 10% of the houses in New York City, or 10% of the dwelling units in New York City roughly have more than one poverty unit or consumer unit, and many of them have multiple units. So one example would be an apartment full of roommates, right? 20-something roommates living together. If we call them a household and give them the same threshold shared, it's not likely that they're sharing any other resources than rent and utilities in some allocation, right? The other more common example is a household that has some extra space. They need the rental income to keep paying their rent. They bring in people who do not have the resources to come in and get their own lease on a separate unit. So in the first case, to give everybody the same threshold would be incorrect, I think. Mm-hmm. And in the second case, we're losing really good information about low-income households that, in fact, the samples go out of their way to include. But we take the poorest of that unit and give it a different level of need based on everybody in that household. So we're losing granular information at the bottom, which I think is really something that we try to avoid a lot, because we get a lot of questions about people within very discrete income brackets and what their needs are. The other more technical reason for this is that I really like a lot of the work that's been done in thinking about equivalence scales. But if the equivalence scales are built on the size and the structure of the household. So if we then smush the household into one unit and not into these different family units, we lose all of that additional information that new equivalence scales would give us. So I would really like to keep that in there. And I have to say that the poverty units have become an amazing tool in the policy world when we start to look at, childcare needs, when we start to look at, they're the basis of all of our other units, tax filer units, SNAP eligibility units, and also health insurance units. They're all hinging on family relationships. And that poverty unit's success or failure to cross the poverty threshold depends on the units that get built by their relationships. In addition, we also do, we step away from the poverty data, go back to the ACS, and run an estimate of immigration status, right? Immigration is key on everyone's minds in New York City right now. The poverty measure doesn't take immigrant eligibility into account to claim benefits, but we then go back, revise, and do. And the majority of immigrants in New York City are living in mixed status households, where somebody is either legally resident but not a citizen, a naturalized citizen, not legally resident as far as we can tell. And you'll see, children of the same generation having different statuses, their parents having different statuses. Eligibility for things like the child tax credit hinge on having a social security number, not even an ITIN number, a social security number. Using those units already in place gives us the ability to go back and look and say, okay, what happens now when we start peeling off people who are eligible for tax credits? And the poverty rate for the immigrant community goes way up, as well as the households that they're living in, because they may not be filing the same tax return.
Thank you.
So-
I don't want to cut you off, but we only have a few minutes left. Go ahead, Leon.
Sorry. So that's my pitch.
Leon, go ahead.
Thank you, Chris. Okay. Thank you so much. So thanks to the panel, thanks to all the speakers today. I echo all your appreciation of this report. I think it's fantastic. It really helps us have a research agenda moving forward. So quickly, my questions that I would want answered before we could actually implement is, does the research support the change? Have we thoroughly vetted it, like we have more with HIPAA than we have with, let's say, childcare, right? Or is the research at that stage, we might agree in principle that this should be a component, but do we agree that the components and the way that we actually operationalize it is ready to go? Can we technically do this? Can we technically do this on time, with the quality, consistently over time? Part of the challenge with using measures used for other purposes is they weren't designed for this. We don't necessarily have the control. If HUD changes their methodology for FMRs over time, we're going to have a change in the poverty measure, and there is a concern that's not due to any necessarily change in material well-being. It's just a technical change when we've actually changed methodology. And then finally, does the public believe we should make this change? Is this something that we think is actually meaningful? Does the change that we are considering help improve our understanding of economic well-being of people in this country? Does it identify subpopulations or subgroups that weren't previously identified as being in poverty? when we change the methodology. Does the methodology actually change our understanding of who is poor or is not poor in this country? And I think there's really this need, and Chris mentioned this, of understanding the trade-offs when we're talking about adding complexity to these programs, adding complexity to the poverty measurement. We might improve accuracy, reduce the ability to replicate this in other surveys, reduce the historical time series. If we don't have data going back in time, we can try, like Chris and I did when we took it back to 1967. We can certainly try, but we will have more breaks in series. We're going to have more difficulty understanding what's happening there. So we have to think about ease of explanation, accuracy, transparency, simplicity, and there are trade-offs. So trying to figure out whether we want to make that change and in what time, what order. So the question was, are there some things that we think we could implement right now? I think that's a great question. And I think the question is, do we want a partial implementation, right? Do we want to implement the things that we might be more ready to do, like HIPAA? We might have the research, we might have the grounding, but would we want a partial implementation? So we made changes in 2021 at the 10-year anniversary of the SPM. I still regularly hear people not knowing those changes in 2023. And so I worry about what's the public's appetite, what's policymakers' appetite, what's the research appetite for changes. So we really try to have a consistent measure over time. We would love to always take any of those changes back historically whenever we can. But the timeline for making sure that the public is engaged, making sure that policymakers understand how we're changing the measure, ease of explanation, I think, is really going to be a challenge with a lot of these recommendations. We might be much more accurate, but have a much harder time explaining what it is that we're doing here. And I think that's something that we need to balance and really consider as we move forward. And so I'll talk more tomorrow at another event about our timeline for change, but I am very excited about these recommendations and digging into this research more. So thank you all so much.
Fantastic panel. Yeah. Oh. Okay. Yeah. Okay. Great. So we had 6 amazing discussants, all raising complementary and different areas. Asking the audience? Am I asking the audience, or?
I wanted to give the panelists a chance to respond to each other.
Oh, sure.
I would like to clarify something about the health benefits. It got to something Chris said, and also that the way we do the health insurance benefits, we don't have to deal with the variation in them. If a plan is good enough, like Medicaid, it's just set exactly equal to the threshold. If people have to pay out of pocket, we accommodate that because that prevents them from meeting other needs. So I just wanted to clarify that, and also that we don't have an equivalence scale issue because it's literally just what the market says the health insurance costs. So basically, we don't have an equivalent scale. So sorry, those are
Sure.
technical
So,
things. I just
yeah,
wanted
yeah.
to
So if there was a
highlight
partial
them.
implementation, health insurance might be sooner ready. I mean, you probably couldn't anchor it because we don't have the price of a silver plan in 1967, but or Medicare Advantage. But there's a lot that could be done moving forward.
Yeah, I want to touch on what Leanna and Chris said. I guess what I would do is I would go through and I would take the ones that are both easy to do, like 4.1 on childcare, count women people who were in school, the same as people who work. That's a trivial change. Conceptually, I would say it's the right thing to do. Not to pander to my host, but I would do the HIPAA because you've got 10 years of research behind. I would go through these things. I mean, as I read them, they're all reasonable. But on the how would you do the child care, I have no idea. So that's lots of research needs to be done on that. But there are 30 recommendations here. If 8 of them can be done easily, and that gets you halfway to the PPM, then you say, well, we're not ready to adopt the PPM, but these are perfectly consistent with the conceptual basis of the SPM. They're just like your 2021 adjustments. They'll be our 2025 adjustments. So those are great points, but I don't think you have to wait to do all of these. And maybe the panel should have a meeting and say, okay, which ones, or a meeting with the census, which ones are easy. And again, some of them, like people weren't using the tax data like Raj Chetty has been doing the tax data in 1995. So again, when David said, and that's a way to get conservative, the Wall Street Journal will support that, you know, count income from the IRS and count SNAP benefits from the USDA, that's not controversial to anybody. Those would be better measures of income. So that would be my response, but I think your comments are well taken.
Well, those are great points, and maybe the panel, I think, is coming back up. Is that the plan? Okay, yeah, so I mean, I guess one question might be just this issue, if it was part of the panel consideration, are there things that could be implemented sooner rather than later, and, you know, or is that something for the panel or panel members to consider?
You need a mic.
Right, that's why I thought they were coming up.
You guys can stay there. You want to come up? You don't. You're just going to make me answer questions? Thanks a lot. So I think there was general consensus on the panel that the HIPAA portion is kind of ready to go, and that we felt as though, if asked, pushed, you know, to prioritize, you know, that the health insurance part was really well developed and therefore should be kind of top priority for the Bureau to try to implement soon. And in fact, they're already doing a lot of work on this and kind of producing estimates along those lines. So we do think that the health insurance, but I want to be a little cautious. There are some amazing child care researchers in this country, and there is a lot of research on the child care area. So it's not as though we have zero evidence out there. It's just that building it into the poverty measure this way is a new research endeavor that hasn't really been addressed. And so it's not as though we don't know much about child care. We do. We know a lot about child care. And there are, you know, substantial data resources available on child care subsidy rates provided by the government to state and local governments out there. But how we build these into the poverty measure is kind of a new endeavor. And so that's why, as Jane mentioned, is something, you know, we're recommending some sequential baby steps, right, moving forward over time. And then kind of housing, where's Ingrid? You know, housing is kind of in the middle. You know, I think Chris, is kind of in the middle. And that that's probably something that could be implemented, you know, relatively quickly. By that, you know, relatively quickly in government time is like, I don't know, 5 years, right? So, but I think there's a lot of evidence out there in favor of the recommendations based on other international measures of well-being, as well as measures of well-being within our own country for a lot of the housing recommendations. So, you know, we would put that as second, but it's not as though you wait 10 years to think about childcare. You got to start now.
No,
right?
it's started, as you said. So I don't think Jane is here, but I'll make one quick comment about childcare research on this. So when I was at ASPE with Sherry Gleed, and so we were, you know, both identifying. You can triangulate information from the Consumer Expenditure Survey, the DOE survey of childcare costs, and the SIP. To really get a sort of good ballpark picture of what childcare costs in the current dimension. And then, taking those, you can take what an average care cost, if cost wasn't so constrained on a national basis, particularly if there was, a universal child care cost where you then had subsidies pegged to what an acceptable rate of child care is. I mean, it's still, that work would need to be improved and continued, but as you said, there is pretty good child care data. And it doesn't vary that much if you use one of the data sets or you triangulate across the three. Yeah.
Great.
Yeah.
One point on implementation that I want to sympathize with Deanna. So one of the benefits of the SPM and having Becky Blank help with the SPM, it came with $5 million for the Census Bureau to implement it. So I didn't focus, but if you read the report, you'll see a lot of new questions that would have to go on the surveys. Those aren't cheap, and a lot of research. So I think that one of the things to do would be to get all of you who would support the PPN and the report to convince policymakers to provide funding to do all this research that they're going to need to do to implement it. And the administrative data, you'll know the recommendation says a lagged experimental measure, so it wasn't implemented immediately.
So I didn't think we'd be in a position to give back time, but I do want to see if Sandy or Ingrid have any responses to the panel's remarks that on overall or in terms of your own work on this panel. Sure. Go ahead, sir. You can just use this.
Well, I'll come sit over here. First of all, thank you to the panelists. Really appreciate really thoughtful comments. And I will say, sort of on the Liana, on the fair market rent, it's on the one hand, I feel like it's ready to go, right, in a sense, right? But I do hear you. I think, maybe HUD is considering changing methods and moving to using more administrative data on rents. The measuring rents is tricky, and it's only getting more problematic with low response rates through the census. So I think it does make sense for HUD to sort of be looking to some administrative sources, which are much more universally used now. The coverage is much better, but I don't know. I think that it's not. It's still conceptually, it's not changing, right? Conceptually, the FMR is still going to be the best measure, I think, the best sort of official measure of what it costs to rent a standard quality unit in your local market. And so it's not, I don't think that's going to change. And so, but anyway, I hear you on the, anyway, and I look forward to, I hope, talking to you more tomorrow and over the coming weeks and months about what are sort of the details on implementing. And I will say the other thing, that there are a bunch of recommendations about, and again, these also will take resources, but about, the census sort of doing research on the implications of these changes and how it's going to change the measurement of poverty and how it's going to change the geographic distribution of poverty. Obviously, in the housing area, that's, really different treatment of housing can really swing, the geographic distribution of poverty. So I think that there's, sort of putting aside the need for resources, all of that could be started immediately. And I don't think certainly there's no need other than as long as the resources are there to get going.
Right. Professor Korenman, last word.
Thank you. I hope somebody else will take a word after me. I just want to say something very briefly, which is this idea of anchoring and doing trends with the health inclusive poverty measure. This is really challenging. The title of the paper that Dahlia mentioned that's coming out in the October Journal of Health Policy, Politics, and Law is something like the importance and intrinsic difficulty of absolute health inclusive poverty trends. They're really far more problematic when you include health insurance to try to do an absolute poverty measure with health insurance. So that will take a lot of research if it's even possible. Anybody like the reference, I'm happy to give it to you. I
What's
don't
the
want to
reference?
keep anyone from wine and cheese.
Oh.
But if there's one more question, or should we? Great.
I'm very curious about the absence of transportation costs from the poverty measure. I'm wondering if anyone in the room knows a little bit about that, especially given its status as probably in the top 3 household costs, and also the fact that there are many good measures in the American Community Survey about travel and transportation, vehicle ownership, commute times, and travel times. So I'm just curious if anyone knows how that got left out all of these decades,
Jim,
especially
or-
given the fact that the census is collecting rich transportation data.
Jim or Leanna? Go ahead,
Yeah,
Jim.
yeah, well, I would just say that, and yeah, Liana, of course, you can come up, please. But I apologize if I, misled you to say that nothing is done about transportation right now. It's subtracted as a work expense in the supplemental measure. And so it comes out of the resource side of the equation. What we were debating about is should we include it as the basic need in the threshold and then potentially change the way it's characterized as a resource. But it is in the SPM right now, and it throws up it's in the multiplier. It's in the multiplier. And work expenses, I guess, is nominally child care, child care and things like that.
The
Yeah.
median commuting
Yeah.
costs is subtracted, so the
Is
number
subtracted, yeah.
of weeks worked. So we do have that
Yeah.
built in, so we're subtracting that, but it's really just transportation for work purposes, right?
Yeah.
So it's only being subtracted so that people can go to work and only for workers, and it is also capped, right? So we're also capping it at earnings, assuming that it's not going to cost more to get to work or buy uniforms or parking and all of that.
Yeah.
Now we're done. Okay, great. Well, I want to thank Baruch and Wagner and Columbia and everyone for coming. This was a great panel and conversation.